Hello and welcome. My name is Dr. Ronald Simwe, and I'm an assistant professor in the Couple and Family Therapy program here at the University of Minnesota in the Twin Cities. I'm looking through my window and we're getting some sunshine. It's around April. And if you've been to Northern America, Minnesota is cold. But today, it's such an honor and a pleasure to welcome our guest, Dr. Ting Liu, to our conversation. Dr. Liu is a very leading expert in and an ICEEFT-certified trainer in emotionally focused therapy. For those of us who might not be familiar with, ICEEFT stands for the International Center of Excellence in Emotionally Focused Therapy. That's the organization that oversees the training and practice of emotionally focused therapy nationally and internationally. Dr. Liu is a special guest today on our channel, and she has a remarkable experience and work that has centered in advancing EFT in particularly in Asian context, working with families, professionals in various Asian countries. Her insights have not only contributed to the development and cultural adaptation of EFT in this region, but have also opened up meaningful conversations around attachment, how we think about emotion, and relational healing in diverse cultural contexts. Personally, I'm very, very excited to meet you today, not only about hearing about your expertise in EFT, but also about your journey into this work. There are younger professionals or early career professionals that are interested in the field of systemic family therapy. So from among the models of approaches to systemic family therapy that are out there, I'm just curious to hear about what resonated with you with EFT. We're also looking forward to learning about your journey and how you came to land on EFT. So thank you so much for joining us. I would love to invite you to begin by just introducing yourself and sharing some personal and professional aspect of you that you're comfortable with for our audience. Dr. Liu, welcome.
Hi, Ron. It's an honor to be here. And my name is Ting Liu, and I was born and raised in Taiwan. And I came to United States at age 25 for graduate education and received my doctorate from the Department of Human Development and Family Studies at Purdue University, specializing in marriage and family therapy. So now I work as the clinical director of Philadelphia Center for EFT, and I'm also the founding director of Asia Center for EFT. And I regularly provide EFT trainings in various cities in North America, Europe, and Asia.
Thank you. Such an impressive resume, and I'm waiting and looking forward to hear your insights. So really, for those who are not familiar with these interviews, we're really capturing voices of diverse, culturally diverse MFTs, marriage and family therapists from the US and all over the world who are doing this incredible job of taking some of our systemic based interventions to other cultures. So Dr. Ting Liu is one of those leading experts in the field and particularly focusing on EFT. So I'm curious, just to get us off started, is how did you choose the MFT field over other mental health disciplines that are out there? Why MFT?
Well, I think just as I was growing up, like all of us, we watch a lot of movies and TV shows. So I have always fascinated by the work as a psychotherapist since I was a child. And um, I didn't know the difference between, psychotherapy or MFT or other form of, mental health services. But I just know that I'm interested in this field. And but as I was growing up, I have seen so many mental health needs among my friends and my families. Many of them were undiagnosed. When I think back, they really would benefit from mental health services. But at that time, unfortunately, they don't have the knowledges or resources to receive appropriate service, especially from 50 years ago.
Yeah.
Um, so in terms of my interests, sort of be more focused in MFT, my first job after graduating from college was doing adolescent therapy, that I was a youth counselor. And
Mm.
during those 2 years of work experience, I realized that presenting problem of teenagers were strongly related to their family systems. And I still remember this one example where a 14-year-old boy told me that he wanted to quit smoking because he had been, given many warnings and punishments for smoking at school. So he told me that he really want to quit. And one day I went to his home with him, and his grandfather, his uncles, his fathers, they lived together as a big family. And they were all sitting in the living room chatting. The first thing they did when we walked into the house was to hand him a cigarette. And I still remember that moment. I was thinking, oh my God, no wonder it's so hard for him to quit smoking.
Yeah.
And through many similar experience, I learned and start to realize that I cannot change people's life through individual counseling because the interaction and influence of their system are beyond the control of any individual.
Mm,
Right.
mm,
So I think that's more from the professional side. And
yeah.
on the personal side, I witnessed my parents' marital distress, and
Mm,
I personally experienced the difficulty as a child
mm,
growing up with intense conflict and tension.
mm,
So as a young child, I often wonder if there is any profession that can change these people's lives and spare their pain. So therefore, I decided to enter the field of marriage and family therapy because that's what I believe where change should occur is through their systems.
mm. Wow, such a beautiful story, marrying and integrating both your personal experiences from your family of origin, watching the distress in your own family, but also working with families that were in distress and thinking about, really thinking about the change happens at a relational level rather than the individual level, particularly the example of the 14-year-old boy that you shared. Um, Fast forward, could you share with us a little bit about so your client base? What's your primary client base? Who do you work with, and what models or model in influences your practice?
Yeah, I have been in this field, I just realized more than 30 years. So I changed a job, over
Uh-huh.
time. So I first worked as a family therapist in juvenile detention center and girls school for 5 years. That's
Mm,
my first job.
mm,
And then I provided intense in-home family therapy at the Virginia County Mental Health Center for 3 years. And
mhm,
now, and then I went into the academia for 10 years, and that's when I didn't see as many clients because of the job. But then when I quit my university job and decide to go into private practice and training, and now I see mostly couples in my private practice. And but I think this is ironic, is that people thought that I would see cases most of my cases will be Asian, but it was only in the last 10 years that people start to know about my reputation as a couple therapist that I started to have more Chinese or Asian clients. I
mm.
think the first 10 years of my career in United States, I probably have less than 5 Asian clients for
Really?
10 years. Yeah.
Wow. What do you briefly, what would you attribute that to, you think, in your own view?
Um, I think a couple of reasons I can think of on the top of my head. One is that it's a relatively small community,
Mm-hmm.
so people may be willing to deal with the language issues
Mm-hmm.
rather than seeking out to someone they may run into in a social setting. I think
Aha.
that may be a reason that discouraged them from working with me, right?
Yeah.
Because it's a relatively small community. And the second reason is I think that for a long time, there is a taboo, right,
Mm-hmm.
against psychotherapy. They don't think that relational issues can be resolved
Mm,
through professional services. They don't think anyone can help you when you had a bad marriage.
mm.
Most likely, they want to come for a lesson. Like they want you to be the doctor who will prescribe them some
Yeah.
kind of strategies, and then just one meeting, and then you will tell them what they did wrong, and then give them advice, and that's it. So for
Yeah.
them to imagine that, oh, I have to come to therapy for 8 sessions, for 20 sessions, that's unthink of.
Yeah. Yeah.
Right. So,
Wow.
but I also see the shift. over time. Now the younger generations feel very differently.
Mm.
So, and I also think that, with the movement, the diversity movement,
Mm.
people feel more accepted, with their cultural of origin. They are not as eager and feel pressure to assimilate into the mainstream culture. And I think the culture of origin and their language are more valued and respected. And I think those are the good shift that we can see in our field.
Yeah, I can relate certainly Ting to some of the cultural barriers you talked about, like the stigma of going to a professional to
Hmm.
talk about your marital issues, your relationship issues. I mean, I'm originally from Uganda in Africa, and it sounds like this is a sort of a shared, not to stereotype, but sort of a shared challenge that we have
Hmm.
even where I come from. It's
Hmm.
coming up now. There's shifts beginning to happen, but people wouldn't go to therapists to talk about their
Hmm.
problems, the and for various cultural reasons. But now the shift is beginning to happen as you describe, which is exciting. Um, Talk a little bit about, so I've known you for your expertise in the emotionally focused therapy. Can you tell us a little bit about that model and what drew you to this model out of the many, many approaches to family therapy or marriage and family therapy that we learn in graduate school? What drew you to EFT?
Um, I think personally, I have always liked the humanistic and experiential models myself.
Mm.
And when I was a doctoral student, I was drawn to Virginia Satir's work and the more Rogerian client center model. So
Mhm.
that's just who I am, and that fit my personality and how I see change. And during my time as a research assistant, I was lucky enough to run into EFT. That was a time EFT wasn't that popular.
Mm.
And I think that in my graduate program, none of the faculty member heard about EFT.
Mm.
So that was, 30 years ago.
Yeah,
Um,
that's at the time when Sue was doing all these cool studies.
yes, yes.
The
And I
development.
think probably at that time, only 2 or 3 outcome study was out. So
Mm.
people didn't really know about EFT. And when we learned, that was a time when we learned postmodern models, EFT wasn't part of it.
Mm.
So I just, run into EFT by accident.
Mm.
And the story that this is more the personal part, and I will tell you the more professional part. And that
Uh-huh.
was during the time a publisher in Taiwan asked me to recommend a book in family therapy to translate into Chinese. So that they asked to have a model that has not been introduced to Taiwan. Because during that time, we learned about Virginia Satir, we learned about Minuchin's work, we also learned about narrative and solution focus. So
Yes.
they want something new.
Uh-huh.
So, and I ran into EFT, so I recommend EFT, and I translate that book, the first edition of Reconnecting, no, Recreating Connection. That's
Mm-hmm.
the first edition, published in
Mm-hmm.
1993. So I translated that book, and because that was during that time the first EFT book that was translated into a language other than English. So
Mm.
Sue found me because that was the first, book in foreign language. So she
Yeah.
was so afraid that I was going to screw up because I didn't know EFT good enough. So she
Yeah.
called me up and asked me to go to Ottawa
Uh-huh.
to attend a EFT externship with her. She wanted to make sure that I know EFT enough to do a good job in my translation. So
Uh-huh.
that's when my journey and my path crossed with EFT. That's the
Wow.
beginning of it because of that book translation. And
Wow.
after that, I translate 5 more EFT book. Um,
Yeah.
yeah, so I was lucky enough like to find EFT in a way that I didn't intend to, but fall in
Mm.
love with it.
Mm.
Right. And professionally, I think I want to talk about why did I fall in love with EFT? And there are
Mm.
several things
Mm.
that attract me to EFT. First,
Mm.
I believe, this is what I really believe that psychotherapy is a science, right? So I like the therapy model that can provide empirical evidence to show us its effectiveness, not just because, oh, I believe it's working or I think it's working. There are scientific evidence to show us that. Right. So I like that. Second, the attachment theory focus on the relationship with attachment figure, which is very consistent with the cultural belief that family-centered
Mm,
well, there's that we send in Chinese family. We
mm,
focus more on the bond between parents and children.
mhm,
So it's really consistent with the cultural belief and
mm,
value.
mm,
And however, I also see that people are often lacking effective ways to find secure connection,
mm,
right? And then third, I think I strongly believe using emotion as a change mechanism for change because cognitive change is not enough to provide necessary change for everyone and every situation. I think especially because of my job experience, I work with people who are often in the disadvantaged group in our society, or those who are unable to function normally in crisis.
mm,
So I see that knowing what they want, knowing or becoming aware is not enough to produce change that they need or they want. It's like, there are so many times we know this is right for us to do, but I don't feel doing it.
right.
I know that this is bad, I should stop, but I just cannot stop myself.
Mm,
But it happened too often, right? That I know what's right and I know what the problem is, and then what?
mm,
Right? And then sometimes knowing that it become a label that we put on ourselves.
mm,
Um, oh, this is the way I was raised, right? This is the way I was. This is my personality. This is not self-acceptance. This is basically saying I'm defected.
mm,
So sometimes when awareness does not produce the change that we need to have something else to
mm,
help us,
mm,
right? And I do see emotion changing through emotion is a good channel, especially for those who are flooded because they are experiencing too much, or for a variety of reasons they cannot function on their normal level. I think changing through emotion is what they need. Right. So that's the second reason that I was attracted to EFT because um, the using emotion as a change mechanism. Right.
So I love how you chronicle your reasons from having this sort of a science base to how change happens in families and relationships and mental health problems to, okay, we need a relational approach because people for many years have been taught these individual ways of thinking about mental health and relationships. But now this is a model that's talking about change in a relational context. And then to add to that, sort of like moving away from the cognitive part, like
Mhm.
we know what to do, we've already thought about things, we know sometimes we know what's wrong, but knowing alone is not enough. Being
Mhm.
able to move from the knowing to the emotion part of the knowing. I like how you chronicle those three. I think that's really profound. Think I'm curious from your work, particularly if you could share with us an example, of course, keeping the client confidentiality. If you could think about some of the Asian couples that you've worked with in your work, if you could really describe an EFT well-known intervention that you've worked with a couple. There's many of them. For purposes of interview, if you could just break it down one,
Yeah.
share about a client that you worked with, and if you could talk about the intervention, what is the purpose of this intervention, and then give us an example of a client you worked, and what was the outcome using that intervention.
Well, I want to talk more from the general problem that people try to apply EFT. Right? I
Mm,
think that there is this stereotypes that Chinese or Asian clients, especially couples, that they don't show affection as much and they don't express emotion, right? Because the cultural value, and which is true in some ways but not completely true because I just think that in any given culture, there are people who are more expressive and there are people who are more reserved, right? So people do have so this is what I believe, that people
mhm.
do have their way to express emotion. Maybe it's not as explicit, maybe it's more reserved, but it's
Yes.
the therapist's job to stay in good attunement and be able to understand them to that level, not to use this general standard and say, this is the way you have to say, I love you in order to show affection. Like we should allow and respect people's own way to show their love and affection, right? The
Yes.
problem is not about how to show it. The problem is
Yes.
about the receiving end. Can the other
Yes.
person receive that?
Yes.
I
Yes.
think it's a sort of narrow to just look at how you express that. We should look
Mm-hmm.
at the relationship and the interaction,
Yeah.
all
And
together, right?
yeah, and
So
attunement to cultural context.
yeah. So for example, people often ask me, what should we do that when we ask client, how do you feel? What's happening to you as blah, blah, blah. What if the client say, I don't know, right? I don't have feeling, or even more aggressively sort of push back by saying, why should we talk about emotion? It's useless. Just tell me what to do. Give me a solution. Talking about emotion is useless. Like, what should we do when this is the client's reaction to our intervention as we try to assess their emotion and deepening, right, through reflecting and heightening? So this is when I was saying that you have to, three things we need to do in order to apply intervention well to, you know, a diverse population. One is you have good attunement that we just talked about, right? You need to know your client's need, what kind of help they need from you. Where are they? What's happening to them? You need to stay in good attunement. And then be able to flexibly change your therapeutic strategies according to their reaction to you. Right? So you have to have good attunement, you need to have flexible strategies, and you need to collaborate well with them. You don't always follow their leads, because sometimes they are clueless, and that's where they need your professional help. But you
Yes.
also cannot be the dominant one because you don't know it all. Right?
Mm.
So the balance between, give and take, how you collaborate with them. So I think those are the three, I guess, principles, right?
Mm.
To
Okay.
apply any intervention well to a
Mm.
diverse population is attunement.
Mm-hmm.
What's the second thing? Attunement
Flexibility,
and flexibility, exactly, and collaboration, right?
collaboration.
So
Love
using
it.
that as an example, if I
Mm.
ask a client, how do you feel? And they say, why should we talk about emotion? I don't know, right? And just tell me what to do, right? So let me give you a short demonstration of how to apply the collaboration with a good attunement and then being flexible. I would
Mm-hmm.
just validate. I start with validation, right? Of course, you don't want to talk about emotions,
Mm.
right? It makes a lot of sense to me because talking about emotion is not only useless. For you, it's a waste of time,
Mm.
right? It may also make it difficult for you to focus on the problem because you may feel discouraged and you don't really have time to sit there and cry. I understand that, right? I understand that. It makes so much sense to me. So what do you do then? What do you do when you feel the stress? Or what do you do when you have to deal with such difficult problem by yourself? So rather than labeling us as being alone, I would change to a different phrase like fighting by yourself, right? When no one will be there for you, no one can help you, when time is running out, when it's become too much, and you don't know what to do. How did you manage that? Because it sounds really horrible that what you have to deal with all by yourself, right? So in this segment, I didn't talk about feeling alone. I didn't talk about feeling pain or fear, but it's all in my description,
Yes.
right? I elicit the emotion without needing to label it first. Because
Yeah.
if I label those emotions and you only make them feel very defensive and then you make them feel too threatened, how is that going to help them?
Mm.
Right? So this is the attunement and flexibility that we were talking about, is that can you find the door
Mm.
that they will allow you to enter
Mm.
and then still allow you to access their emotion without like putting the label on the emotion.
Yeah. That's such a profound point, Ting. Oh, and I see today, I mean, even when I was learning EFT as a younger EFT therapist, the quickness at which I wanted to dive in and name the emotion, the whole idea of name it to tame it kind of thing. And I quickly realized that not many clients, and even if we went to, I used to think, clients in America would be open to talking about that stuff. No, it's not many people are ready or coached or even, ready to really go into the emotions and talking about them. And so I had to learn to slow down. And even as you're
That's
talking and
right.
describing attunement, I was just following and I'm like, oh wow, that validation. I mean, it's really, really powerful for our therapists who are learning to really hear how you articulate that. You don't have to name the emotion. You don't have to be quick to label the emotion or to say you feel lonely or you feel alone. The way you did it is so amazing and profound. I love it.
And then you asked me about like how give you an example of the outcome that when
Yeah.
I try to do that, I have this client who is very tough. She's a single mother and she raised two boys on her own and she struggled a lot, right? So she has to be tough. It makes a lot of sense. She doesn't want to talk about feeling and she doesn't even own up to any vulnerability. She's just a fighter. So one time she was talking about a drive-by shooting in her neighborhood and two boys live in her neighborhood was killed in front of her. So she was terrified. We know that there may be some PTSD because uh, this incident, but then she denied. I said, and then she had two teenage boys. So I say, oh, when you witness that incident, that scares you. She said, no, I'm not scared. And then so I say, okay, maybe fear is too strong. So I slice it thinner. I say, so she repeat the same story. So it bothers her, right? Because she repeat the same story. So I slice it thin. I say, so it worries you that you worry about your boy, that they have to walk the same way home every day, right? What if it happened to them? She said, no, I don't have to worry about them. They grew up here. They should know how to protect themselves. There's nothing to worry about, right? So even worry is not going to work. So then I said, so I try to say, so it concerns you. No, no, I'm not concerned. So she keep denying it. So
Yeah.
at the end, I was like, okay. So because as she was talking, something just hit me. I said, so because of what happened and because of the neighborhood you live in, you have to be cautious all the time. She
Mm,
said, yes, I had to be cautious and be alert all the
mm,
time. I mean, for us, we know that it's the same category, right? Fear,
yeah.
worry, concern, anxiety, and caution. Those are
Yeah.
all fear. But then
Yeah.
for her, caution is the door.
Wow.
Right. And several sessions later, as she feels safer with me and I was able to access some vulnerability, she actually start a conversation with me about this conversation. She said, do you remember we talked about this? And you asked me if I was scared, and I told you no, because I realized I would never had time for myself to be scared
Mm,
because I have to use all my energy and my time doing what I have to do.
mm,
I don't have time to just sit there and be scared.
mm.
I mean, what an amazing insight.
Wow. Yeah, yeah. It really describes us your process of which the process of how you broke down validation, attunement, and flexibility.
Mhm.
But also, particularly within this client, something I picked on, and correct me if I'm wrong, is the whole systemic idea of multiple ways to arrive at a solution to a problem, right? It's a big systemic idea that we talk about, and you describe it beautifully, finding multiple entry doors, right? That it's not this, it's that, we try that, but it also takes a lot of therapists to be patient and flexible and attuned, which are, fundamentals of EFT. But, I love how you describe it with this client.
Yeah.
I
And
wish,
just tell you a joke. So then
uh-huh,
I learned that in the future, when I have client who doesn't like to own up to their vulnerability, I would just start with caution, right? I thought that caution is more, it feels like they are more in control, not as vulnerable. So I start with caution. And then
yeah,
I had this client who doesn't like the word caution. He said, well, when you said I was cautious, it made me feel like I'm neurotic. And he doesn't
oh,
like it. And I
mm,
say, okay, so caution is not a right word. So how would you describe that experience? See, this is
mm,
collaboration, right? You don't like that. That's okay. That,
mhm,
I was wrong. I'm sorry. So
yeah,
how would you describe that? He said, I'm just a very careful person that I like to think think things through before I take an action.
Wow.
See,
That's a
that's how he described that. I mean, for us,
yes.
that's caution. That
Yeah.
you think several times before you take action. That's caution. But he doesn't like that. He want to use his way to describe that, right?
Yes.
So
Yes.
I just borrow his words. Like in the
Yeah.
future, I don't talk about fear. I don't talk about caution. I say, is this the time that you have to think more times, or you
Yeah.
have to think about it?
Yeah.
So
Wow.
that's the beginning. That's the entry.
Love that. I love that. The collaboration. Wow. 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 Attunement, validation, attunement, flexibility, collaboration. I like how you chronicle those. I wish I could talk to you for an hour or so, but I'm
I
watching the
know.
time and we're running out. But real quick before we end this conversation, I'm really fascinated to hear some of the contextual challenges that you have faced in practicing from an EFT perspective with your primary client base. If you could talk a little bit, one or two challenges that you've faced, and then if you have any advice for people that might be interested in practicing through an EFT lens, what would you encourage them to think about or do?
I think the challenge is not so much about using EFT, but then it's the whole field of psychotherapy. I think the
Mm,
taboo and the stigma we were talking about, although it sort of lessened over time, but it's still there. So
mm,
I think that the more good therapists that we train, right, the better experience people have, and then they can benefit from psychotherapy, the easier it will be for us. So I feel like we just need to do more randomized clinical trial study, and then maybe more process research to better understand the cultural applicability of the EFT model. I
mm,
think for me,
mm,
because sometimes I believe that I personally I have made many cultural adaptation without consciously knowing what I have done.
mm,
I think that it will be really interesting to really do a process of research and just to watch the video to see how, like, is there anything that I made a clinical decision without, being very conscious about that, or there's any adaptation that I find it very useful. I think that will be um, a good contribution to the field,
yeah.
right?
Wow. Wow.
And the advice for the young professionals, when I first started my my work as a EFT therapist and trainer, people used to tell me that you need to trust the model. And I
Mm,
hate that because I sort of feel like we are professionals, we are scientists. Like we are not, preachers, or we are not missionaries, right? So
mhm,
why should I trust the model? And 30 years later, I realized I was wrong.
mm,
And because I misunderstood this statement. When people say you should trust the model, they're not saying that you should trust this model is effective. That's not what they're saying.
mm,
But I think now I feel like I do need to trust the model. One is I do need to trust that there are emotion. As long as there are triggers, there are emotions. Sometimes clients do not know that. Sometimes we don't see that, but it
mm,
must be there.
mm,
In order to change their emotion and how they feel, we have to change the triggers.
mm.
You have to identify the trigger. And if you don't trust it's there,
Yeah.
right, you won't dig it out. Right.
Yeah.
So that's one thing you need to trust. And the second thing is that, in modern society, we train ourselves to be so independent, right? But I still believe that, connection is a healthier way for us to function in our society. And I trust that if people have choice, that they always have attachment longing, right? And I want to borrow Sue Johnson's word. One time people interview her and ask her, what do you think is the most important characteristic as a good EFT therapist? And people thought she was going to say, oh, you had to be really sensitive to emotion. You had to have good language skill to articulate, blah, blah, blah. No, that's not what she said. She said, you need to be brave and you need to be relentless because change is hard.
Mm. Wow. So, just to sum it up, trust the model, be brave and relentless.
Yes.
Dr. Ting Liu, it was a pleasure chatting with you. I wish I could talk to you for hours and hours. Yeah, I just learned something new about even when I tell my students, trust the model.
Mm. Thank you.
Wow. Thank you so much. This has been a pleasure.
Well, thanks for having me.
Thank you.